想象一个世界，我们只需要调整你的维生素 D 水平，就能极大地改变自身免疫疾病的结局。科因布拉博士开发了康热科因布拉方案，他是世界知名的医生，利用高剂量维生素 D3 来研究自身免疫性疾。我很高兴邀请您来做客，博士，很荣幸见到您。您是如何第一次发现维生素 D 和自身免疫之间的联系的？
Back like 25 years ago, I was working in a hospital as a neurologist, and I saw a patient who had Parkinson's disease. And I was aware that vitamin D induces neurotrophic factors in our brain. So I decided that I should try to give him 10,000 units of vitamin D per day. And at the same time, I could see that he had vitiligo affecting his forehead. So I gave him vitamin D, trying to help him in respect of his neurological disease, trying to slow down the progression of Parkinson's disease. It turns out that when that patient came back, those lesions were almost disappeared. I was asking him what kind of treatment he was under for vitiligo. He said, nothing. I just took the vitamin D that you gave me. I was amazed to see that, and I was wondering what possible mechanisms vitamin D could be involved in preventing autoimmune diseases like vitiligo. We started using 10,000 units of vitamin D, and then as we learned more, we could increase the doses progressively while we were checking to make sure that those patients would not develop intoxication due to the doses of vitamin D. Then as time went by, I was getting more and more familiar with the effects of vitamin D, and I saw that I could prevent calcium increase in the urine when I asked them to decrease dairy products in their diet. So I was amazed to see how diet could affect possibility of intoxication using high doses of vitamin D.
I think the main toxic effect in certain situations would be too much calcium in the blood.
Yes, that's right. Vitamin D increases calcium absorption from food. That's when we started using vitamin D. Just like 10 years later, we were amazed to see that like 90% of patients were having a normal life.
Explain why higher amounts of vitamin D are needed in cases with autoimmune. Why would you need to use that much to create an effect?
People with autoimmune disorders may have polymorphisms affecting any combinations of 9 genes that vitamin D requires for proper function.
And when we're talking about a vitamin D polymorphism, we're talking about someone that doesn't absorb vitamin D like they should.
Most people are vitamin D deficient. Due to the lifestyle that we have, we are not exposed to sunlight anymore.
Most physicians are taught this one part of vitamin D, which is about bone and calcium, right? And that's a lot of the research is based on preventing rickets.
Since 1988, vitamin D receptor was not found only in tissues related to calcium metabolism. It was found in nearly all cells of our bodies. This finding triggered a lot of different lines of research trying to figure out what is vitamin D doing in the brain? What is vitamin D doing in the immune system? If you have any problems related to vitamin D metabolism, this means that you will be prone to develop a large number of diseases. So it's amazing to see how this large amount of publications, research, are not mentioned in medical textbooks. It's not mentioned in medical meetings. Regular doctor does not know about that. publications that would possibly decrease the consumption of expensive medicine. If you are in an emergency situation, you need to correct your vitamin D immediately. You can't wait 3 months giving 10,000 units of vitamin D. In order to reach that level immediately, you have to give 600,000 of vitamin D in a single dose.
I was looking at the research on using those high levels, 300, 600,000, before surgeries for better outcomes.
In those cases, I may give 600,000 of vitamin D even 2 times in 2 different days. And then I would start giving vitamin D like 1,000 units per kilogram. But this is an average.
Let's say, for example, myself, if I had an autoimmune disease and 1,000 IUs per kilogram, and I weigh 185 pounds. So we're looking at roughly about 80,000 IUs of vitamin D3.
To treat autoimmune diseases, as an average, I give patients 1,000 units per kilogram is the daily dose. So that's the way to adjust the dose of vitamin D according to individual resistance of vitamin D.
This might be a crazy thought, but would the idea of maybe adding magnesium help to kind of control the calcium, since it does help regulate calcium?
Definitely. If you have low levels of magnesium, then you may have a resistance to vitamin D just because you are magnesium deficient.
Now I want to go to an even more fascinating topic, vaccines and aluminum.
When you inject aluminum in vaccines, aluminum is not eliminated by the kidneys. It remains in our organism. It is within the immune cells and it enters the brain, carried by the immune cells. There is a lot of research by Christopher Exley, and he has shown that in the brains of people who died, they had autism, and they found high levels of aluminum in the brain tissue. They went to the University of Oxford in England, and they got samples from the brains of patients that had autism when they died. And they could see in the microscope that there were lots of nanoparticles of aluminum. It's amazing to see the number of vaccines and how people just accept that as something being normal. I've been treating autism since 2014. I was in high doses of vitamin D. In a way, autism is an autoimmune disorder, and in another way is also a manifestation of toxicity caused by this aluminum. It causes a lot of abnormal metabolic changes. Every now and then I received patients, their children are adolescents, and I was amazed to see the number of children and adolescents that are depressed nowadays, committing suicide. And this is increasing in the same rate that autism is increasing. So at some point, I received here a MS patient, and her daughter was 17-year-old. The patient told me that when she was only 4 years old, she was so depressed that child had to take antidepressant drugs. And because that girl was born in 2006, when she was receiving lots of vaccines containing aluminum, I decided to give her silica. That substance binds to aluminum, and both silica and aluminum are eliminated by the kidneys. And she came back a year later, and she said that her depression was almost gone. She said that she was 85% better, and her psychiatrist was decreasing the drugs that she was taking. The psychiatrist thought that maybe she was no longer needing all those medications. You see, this is a a tip of an iceberg.
This is amazing. So you have trained a lot of doctors, and I think, if I'm not mistaken, on your website, there's a place to go where someone can find one of these doctors. Is that correct?
But yes, you can find doctors that we have trained in countries like Germany, USA, Italy, France.
I'm going to put all that information down below, but I really appreciate this interview. This has been very enlightening, and I think this is going to help a lot of people. I really appreciate you sharing this information. It's been extremely valuable.
Thank you. Thank you for the opportunity to pass that information.
Absolutely.